All right, all right. The Medigap Broker LLC. That's who we are. We operate under a couple of different names. The Medigap Broker, Brock and CREDILLE Insurance. My name is Justin Brock. I'm so excited that you've made it here because you clearly have some questions regarding Medicare. You're probably about to make that transition, or you don't know if you have to because you're still working or you're still covered under a spouse's group plan. Any number of situations, and I'll try to address them. But I'm so pumped that you're here because I'm going to try to simplify this for you so you can get rid of all that junk mail, all the different companies that are sending you things, all of this just jargon and mess. I'm going to try to simplify every bit of it for you. So let's just dive right in. I'm not going to waste a whole bunch of your time, okay? So first things first. Again, my name is Justin Brock. Our business here is called Brock and CREDILLE Insurance. That's the name we've been doing business under since 1992, with an emphasis on Medicare. We do a lot of business under the name the Medigap Broker. We started doing that because CMS, the Center for Medicare Services, in the past couple of years started calling Medicare Supplements Medigap, and it just was appealing to people. So you could hear me maybe reference on our websites both of those names, so that's why I put that on there. Just to give you some of our information, if you wanted to get a hold of us, that's a little bit of information. That's our phone number, email. If you want to write any of that down, you can, and that's also a link to our primary website, BobbyBrockInsurance.com. Bobby Brock is our founder. He's my dad. So I'm going to go ahead and continue on really quick. Just to warm you up to who I am. I'm just a regular guy. I got out of the Marine Corps to work in our family business about 4 years ago. Have a couple of kids, a wonderful wife, and I spend the majority of my time trying to help people transition to Medicare now and do it with ease and comfort and not be stressed out and worried about what's on the other side. So, all right, okay. So first thing I'm going to get into is enrollment periods. I'm not going to bore you with this a whole bunch because if you do have any specific questions, you can always email me or anything like that to get the answers. But basically, when you're turning 65, you're in your initial enrollment period. A lot of people refer to this as open enrollment. It's not an annual election period like that one that's in the fall of each year. That's something where people can change drug plans and Medicare Advantage plans separately without, that's just the period that you change those, and we'll get a little bit more into that later. But when you're turning 65, you have an initial enrollment period. It's a 7-month window that encompasses the month of your 65th birthday, the 3 months prior, and the 3 months after. If you or your spouse has group coverage, you can delay enrollment and not have a penalty as long as you have creditable drug coverage and group coverage. You make sure that prescription drug coverage is creditable before deciding to delay, or you might have to pay that late enrollment penalty. So just make sure it is good group coverage. But if you do have group coverage, you can delay it. Okay, so there are some special provisions regarding COBRA. That very rarely hurts you because if you are in a COBRA status, you should just go ahead and drop that because it's probably going to be overpriced anyway compared to Medicare supplements or plans or drug plans. So let's go ahead. Next enrollment period is called a special enrollment period. Special enrollment period is given to individuals for various reasons, and it allows them to enroll in Medicare without paying a late enrollment penalty. The most common one is, say you're turning 65 now, but you're covered under a spouse's group plan, or you're covered under your group plan and you're not retiring. So when you do retire later, you would get a special enrollment period because you're involuntarily losing that group plan. So sometimes I veer away from the script here, but the most common SEP or special enrollment period I see is for someone who has worked past 65 and is now retiring or losing group coverage. So anyway, that's a big question that a lot of people have. Let's see. General enrollment period is a whole nother enrollment period that is made for people who choose to not enroll in Medicare Part B during their initial enrollment period or during their special enrollment period. This is very rare. Every now and then I run into someone who decided not to get Part B and had no other coverage. I don't recommend doing this. I mean, unless you have TRICARE or a group plan completely active, don't just defer Part B because it is a big portion of your medical coverage. So let's get past all that. So getting past enrollment periods, because normally that addresses most of your questions on those. So parts versus plans. Okay, this is something a lot of people have problems understanding because you get a lot of mail regarding Plan F and Part A and Part B and Part D and Part C and Plan G. And so I'm just going to separate these two for a minute. First of all, there are parts of Medicare. Medicare is comprised of Part A, B, C, and D. Part A and B are original Medicare. Part A is hospitalization coverage. Part B is medical coverage like outpatient. So a lot of people refer to Part A as the room and board of the hospitalization. They refer to Part B as just about everything else. So Part C is Medicare Advantage. So, that's some people have Medicare Advantage. I think about 22% maybe of Medicare beneficiaries right now, something like that. And then Part D is drug coverage. So Part C is optional. Part D is also optional, but you're typically going to want to have some drug coverage. Occasionally, if you have Part C, if you choose Medicare Advantage, it will have the drug coverage included in it. So I'm going to break that down a little bit further. I know that's confusing. Let's see here. Parts versus plans. So just kind of went over that. Part A, hospitalization. Part B, outpatient medical. Part C, Medicare Advantage. Part D, prescription drug coverage. If you're taking notes, you could write that down. On the Medicare card, you can kind of see there what it looks like. You're going to have a Part A and a Part B effective date, hopefully. If you're still working and thus have group coverage, you would just get a card like that with no Part B effective date on it. If you're still working and have eligible group coverage with drug coverage and all that, make sure you're not simultaneously paying for Medicare Part B because you don't need both. I do see a lot of people that unnecessarily pay for that while they have group coverage. Okay, so your Part A premium. Most beneficiaries don't have to pay a premium for Part A because they've paid for it throughout their life in taxes. As long as you've worked for 10 years or your spouse has worked for 10 years, you should not have to pay any premium for Part A. If you don't qualify for that free Part A, then the cost could be up to $413 a month. That's very rare, so if that applies to you, I would just send that as a question later, and we'll figure out what that premium is. Part A out-of-pocket costs. So this is if you have original Medicare alone, what are your out-of-pockets under Part A, the room and board? So you have a $1,316 deductible per benefit period. You have a $0 hospital daily copay for the first 60 days after you pay that deductible. So that's that benefit period. Then you have a $329 daily copay for day 61 through 90 of each benefit period, and a $658 daily copay for days 91 through 150. Those days 91 through 150 are considered your lifetime reserve days, so you get those once in a lifetime. Other plans may provide extra days, and we'll touch on that. So you're not necessarily limited to only 150 days of hospitalization if you have another plan. But with just original Medicare, that's the way it's going to work. Skilled nursing facility is under Part A, so that's kind of like a rehab center or a sling bed, as some people refer to it. You have a $0 daily copay for days 1 through 20. You have a $164.50 copay for days 21 through 100. You would pay, under just original Medicare Part A and B, you would pay 100% of the cost after day 100 in a skilled nursing facility. Going forward, the Part B premium. Part B premium for individuals becoming Medicare eligible and deciding to enroll in Part B in 2017. The Part B premium is most commonly $134 per month. If your Part B started before then, say for disability or something like that, or if you turned 65 before 2017, your Part B started before then, it would be closer to $109 per month, and you would be grandfathered into having that premium only increase as much as your Social Security increased because of the hold harmless clause. So it says there, this is because there is a hold harmless clause that says current beneficiaries' Medicare Part B premiums can't increase more than their cost of living in their Social Security check. And as we've seen, most people's Social Security checks are not going up very much right now, so their premiums aren't increasing much. But for most of you, if you're turning 65 this year, just now getting Medicare, $134 a month would be your Part B premium. The premium is also income tiered, so I'll put an income chart on the next slide so you can see if you're past a certain income, it can be higher than that. Also, if you qualify for extra help in your state, the premium, the Part B premium may be paid by the state. So sometimes in a lower income tier, you can get your Part B premium paid for you. This is the income chart for if you have to pay more. So you can kind of see if you file individual tax return, it's that left column income tiers. If you have file a joint tax return, married filing jointly, if you're $170,000 or less, it's still $134. Married and separate tax returns, it's $85,000 each or less, same as the individual return. So for most people, you're going to fall into that, but they do go back 2 years. So they're using your income from 2015 to get your premium for this year. So they always go back 2 years on that. I don't know why they do it that way, but that's the way they calculate it. If you have any questions about that, let me know. Okay, going into Part B out-of-pocket cost. You have a $183 calendar year deductible. You pay 20% with no limit after that. So you pay 20% with no limit after that Part B deductible. So this is a little bit different than what a lot of people think of as 80-20 coinsurance. Because with a major medical plan with 80-20 coinsurance, that 20% has a cap or a maximum out of pocket or a stop loss that says at $5,000 or $6,700 or $10,000 or whatever it is, it says you're gonna have 100% of your expenses paid past that. With original Medicare, it's not that way. That 20% has no limit on it. Services covered under Part B include, but are not limited to, outpatient surgery, doctor's office and specialist visits, MRIs, CAT scans, durable medical equipment. That can include insulin pumps for diabetics that have insulin pumps. And then if you do have an insulin pump, then the insulin that goes into it is covered under Part B instead of your drug coverage, which can be a big money saver. While hospitalized, there are several services rendered that would still fall under Part B, and you'd be charged that 20%. So just because you're hospitalized doesn't mean you're not having some Part B cover things. For instance, surgeries, anesthesiologists, having certain specialists come and visit you, certain procedures that are done. A lot of that's covered under Part B, and you can be charged the 20% under that. One notable thing that's overlooked is observation periods. They do have to let you know when you're under observation period now, but an observation period is when they can keep you up to 72 hours in the hospital and you aren't considered hospitalized, and that would mean that entire portion you could pay 20% on, if you didn't have a supplement or something to pick it up. Okay, so let's go to the next calls. So Part C costs. This is Part C of Medicare is a little bit confusing. If you choose Part C, you are essentially choosing a privatized version of Medicare in which you have Medicare claims paid by a private company. This is referred to as a Medicare Advantage plan. Premiums range approximately from $0 to $100 a month. You still have to be enrolled in Part B and paying a Part B premium of Medicare to have a Medicare Advantage plan. Some of these plans do include drug coverage, so we'll loop back to those. Well, here's a little bit more information. Let's see. So out-of-pocket costs can vary between Medicare Advantage plans. Each state and area has different ones available. The coverage has to at least be as good as Medicare Part A and B, meaning that it has to be considered by Medicare to pay for just as much as original Medicare itself. Typically, these plans have a maximum out-of-pocket that ranges from around $3,500 to $6,700. Probably more commonly, that's $6,700 per calendar year. Sometimes it can be lower than that, though. They also use a network of doctors and hospitals, and you may be required to stay within a network, sometimes staying within a region or a state. So a lot of times when you're traveling, these plans, a lot of people don't like them because of the travel aspect. Not to say they wouldn't treat you for emergencies, but if you're going to be traveling outside an area and you're in an HMO, Medicare Advantage plan, that may not be suitable for your lifestyle. So let's see. Okay, Part D premium. So Part D is your prescription drug coverage. Like I said before, it can be covered in Part C if you chose a Medicare Advantage plan with drug coverage. But if you don't, then you're going to have that standalone drug plan. Part D costs vary depending on the plan, and in most states there are around 20 different plans available, and the premiums vary from around $17 to $100 per month. Most people are fine with a drug plan well under $50. I'd say most commonly we help people enroll in ones that are around $17 to $25. That's very common. Sometimes with some more expensive medications, they may get higher than that, but that's a very common thing for us. The key to picking a good plan is to use your drug list to ensure that your prescriptions are covered well by the plan you pick. So we take your drug list with dosages and everything, and we put them into Medicare.gov's calculator, and it will tell us which plan is going to be the best for you during that year. It's very important to shop your drug plans yearly to make sure they're still covering your drugs, and we do that for our customers. Okay, Part D out-of-pocket. Part D plans will have a tiered copay system, and each of them varies based on which drugs are in the formulary or in their formulary and how much they charge for each tier. There are different coverage levels with Part D plans. For most people, they're going to stay in that initial coverage level. It's the coverage level that it's just kind of the basic way the plan is designed. You're just paying your tiered copay. If you have more expensive medications, enough to where your total cost for drugs surpasses a certain amount, which I believe right now is around $3,700 per year. So if you pass that amount in total cost for drugs, you could go into the donut hole at some point. The donut hole is the most confusing concept about Medicare. It is notable that each year they are decreasing the window for the donut hole, and by January 1st of 2020, there will be no more donut hole. Now that we've determined that, it is going away. Let's try to understand how it works a little bit. So once the total cost of your drugs for one calendar year has been $3,700, you will enter the donut hole or coverage gap. You'll then be responsible for 40% of the cost of your brand name drugs. Generic drugs costs often decrease during the donut hole. You leave the donut hole once your total cost in the gap amounts, in the coverage gap or the donut hole, amounts to $4,950. These are based on 2017's numbers. That includes the manufacturer's discount that you get on there, what you pay, and what the plan is paying. One thing I can't explain is what they're thinking when they came up with this coverage gap, but I am glad they're getting rid of it effective January 1st, 2020. Okay, let's see. Catastrophic level. The last level of Part D coverage is the catastrophic level. In this level, you will pay 5% of the cost of your drugs, and the plan will pay the rest. It is important to note that the majority of my customers don't take anything expensive enough to get them to the donut hole. But if you do, it is a huge factor in your decision-making process, and you should definitely have help deciding on a drug plan. So if you're taking some very expensive medications, that can be catastrophic, especially if you're taking like multiple insulins and inhalers or things that are more expensive than that even. You definitely want to make sure you get in the right drug plan. Okay, so plans. When we start talking about plans, we're getting into the Medicare Supplement, Medigap range most of the time. Sometimes, they refer to drug plans or Medicare Advantage plans as well, but these are the plans that you pick out. So when Medicare professionals or insurance agents refer to plans, they are talking about insurance products that either fill gaps in the parts of original Medicare or the plans that acts as parts of Medicare, the plan that acts as part of Medicare. There are 3 different types of plans you will hear referenced. You have prescription drug plans. We just went over those. Prescription drug plans are simply private insurance products that act as your Part D. So your Part D isn't purchased from Medicare. They're insurance plans that have to work within the confines of the way the government or Medicare sets up Part D. So when I say there's about 20 different drug plans available in most states, those are insurance plans that we have to pick from. Let's see. Medicare Advantage plans. We also touched on this earlier. Medicare Advantage plans are Part C of Medicare, but again, these are plans that are administered by private insurance companies to take the place of your original Medicare Parts A and B, sometimes D as well. They are required to provide at least as much coverage as Part A and B. They typically have a maximum out-of-pocket per year of between $3,500 and $6,700 on the medical cost. These plans also frequently have drug coverage included with them. Okay, Medicare Supplement plans or Medigap plans. Medicare Supplement plans or Medigap plans are insurance products that go along with your original Medicare to cover out-of-pocket expenses. Some plans cover all of the out-of-pocket expenses associated with Medicare, like Plan F. Some leave holes for you to pay some of the costs yourself. Let's see here. So choices. When you decide to take that plunge, whether it's when you're turning 65 and you are retired already, you're already drawing Social Security, or maybe you're still working but you think it's going to be a better deal, or if you wait until you're going to retire later, you'll still have to make a choice at some point. Original Medicare with a standalone drug plan and a Medigap plan, or Medicare Supplement as it's also known, or a Medicare Advantage plan that covers all of that stuff. That's typically your 2 choices. I mean, the only other choices are if you have Medicaid that's picking up the slack for you or something like that. So let's see. Original Medicare with a supplement/drug plan. This is what most of our customers do. It tends to be the way that they lean, the ones that come to us anyway. To pick a drug plan, we would use a list of your current prescriptions. We would input them into Medicare.gov's plan finder to find out which plan would best cover your drugs. Lots of people ask me about specific drug plans that their friends or family have, but with drug plans, it all depends on what prescriptions you take. Picking a supplement is much more simple than the drug plan. It's just all about, what coverage you want and what price you pay. So picking a Medicare Supplement plan, Plan F pays all copays, deductibles, the 20%, and the excess charges associated with original Medicare. It also has a foreign travel emergency benefit. Plan G, which is the one that's become the most commonly purchased, Plan G is in greatest value. That's not really what it stands for, but that's kind of what we say it stands for. Pays all copays, the Part A deductible, the 20%, and the excess charges. but you pay the $183 calendar year Part B deductible, typically costs much less than Plan F, and the premium increases have been slower in recent years. Also, it has a foreign travel emergency benefit. Now, why do I say that it's normally a better value than Plan F? Typically, it's a better value because even though you pay that $183 deductible per calendar year, that Part B deductible, in Plan F, you don't pay that deductible, but Plan F typically costs between $200 and $400 a year more. And statistically, Plan G has gone up slower than Plan F. So a lot of people look at it, and it just seems like a better value to have Plan G. Of course, we still do, plenty of Plan F. We'll do whichever one someone is comfortable with. Plan N is the third most common plan. This is when someone's really trying to get their costs down, or they don't think they're going to go to the doctor much. With this plan, it's just like Plan G, except you would pick up a $20 doctors and specialist office copay in addition to that $183 deductible, and a $50 ER copay. So you pick up some copays with it, but again, the cost of the plan lowers because you're picking up more of your own expenses. Okay, picking a Medicare Advantage plan. Medicare Advantage plans are vary drastically depending on what area you live in. We can help compare them. It's much easier just to talk to us and have us look up what's available in your area and kind of point you in the right direction. All right, the next steps are important. These decisions are really tough. And they should be made completely non-biased, yet in an educated fashion. So, you shouldn't have any kind of bias in what you're leaning towards, like, someone working for one company telling you that their company is the best. Of course, that's going to be a biased thing. So that's why we contract with, just about every company imaginable so that we can be non-biased in which ones we use. If you go off of what so-and-so says, like your brother, your sister, your friend, your neighbor, someone who's in your Sunday school class, whoever it is, whatever they tell you to do, you may end up getting yourself into a huge pickle because a lot of times their situation isn't ideal to compare to yours. So a lot of times so-and-so is extremely healthy and hasn't figured out the cons of their plan yet. Maybe they enrolled into a plan that has a strict network and they have no health problems, and then they decide, or then something happens later on after they've recommended this to you, and they have, a huge heart problem and they have to go to a cardiologist. Turns out they have to go to cardiologists that they don't want to go to because that's the only ones that will take their Medicare plan. So that's a situation where just going off what someone says may not be the greatest thing to do. It's always good to look at them subjectively with someone who's educated in it. So-and-so may not ever travel either, and maybe you do, or vice versa. So maybe if you travel a lot out of the area, maybe you want a plan that doesn't have a network where you can use any doctor that takes Medicare. Or maybe you don't travel, so maybe that's something you don't worry about. So maybe you don't need to spend as much money on a plan to do that. It's all dependent on who you are and how you're living your life and what kind of health you're in and those types of things. There are a lot of things to consider, and I see people choose drug plans or supplements based on a friend's recommendation a lot, only to find out it doesn't work the same for them because they're on different meds or they use different doctors, etc. So what you need to do really, and what's the most helpful, is to click the button below. It's not going to bite you. It just sends some generic information. It doesn't automatically. When you click that button, it takes you to a page where it has just some information for you to fill out that comes to us and allows me to send you more information specific to your situation. Also you can call us directly. That's if you call that 1-800 number that's going to be on this next screen, that will come directly to me. So you can call me. But if you don't want to do that, you can click that button below. It'll fill out some generic information. I'll be able to send you quotes on different types of plans that show you what's available in your area. We're non-biased, so I will show you everything that's available. And any questions you have, You'll be able to email me back with the questions. You'll be able to call me. We're a very low pressure type of agency. We get our customers by providing more information than everybody else, and just being better at providing good information and non-biased information. So that's really it. I mean, that's my phone number there. That's my local number. 662-321-0996 is my cell phone. That 1-800 number is a toll-free number that still comes directly to my cell phone, 1-800-462-3980. If you don't get me, you can leave me a voicemail. I will call you back. That's my email. That's justin@msgap.net, like msgap.net. And then that's our website. You can check out some more information on there. It kind of helps summarize this. I will send you a link to this video, this webinar recorded, so you can rewatch it and kind of skip around as you want to. But again, just get in touch with us. Hit that button, and send us some of that information, and we'll get you the best information for you. Not generic information where we're trying to do a one-size-fits-all plan, when one size does not fit all with Medicare. So I really appreciate you guys allowing me to help you out. I'm super grateful that you're trusting me to give you any answers, and I hope that you'll trust us to help you help you answer any more questions you have, help you pick out a plan if you need help with that. Anything you need, we'd be more than happy to help you. So click that button below or shoot me an email, and we'll take care of it. So super excited that I was able to answer those questions. Look forward to hearing from you in the future. See you later, guys. Bye-bye.